All right, welcome back to the Dental Debrief, the podcast where we talk about the nuts and bolts of dentistry. I'm Tim, this is my best mate Maheer, and we run a practice called Azure Dental in Perth, Western Australia. So today we want to talk about patients because they're everything to us. So Maheer, my first question for you, how do you go about building trust with your patients?
It's a big question. We could talk about this pretty much the whole day. But for me, number one, communication. It just comes from like spending time. Most of my appointment is just us sitting like this, talking and finding out what's important to you, what's bothering you, and what problems I see. So number one is communication. Number two, I think the photography and the scanning really helps. Rather than me trying to explain what's going on in your mouth, if I just show you what's going on in your mouth, then there's no sort of gray area. We can see there's a hole there, we can see that tooth's broken, and then we just go through options. And I think options is the secret. Talking about all the options, the benefits of each option, the considerations of each option, and then just supporting in with decision you make.
Yep, absolutely.
So Tim, how about you? How do you find you can build genuine trust with your patient?
I think the most important thing in building trust with patients is just looking after people. A lot of patients come in and they want to know, is there a guarantee for this work? How long is this going to last? If this breaks, is there a warranty? It's really hard in dentistry to sort of give a warranty because it's such an inhospitable environment in the mouth. But like I say to people, I'm here to build a business and I'm here to build long-term relationships to people. If something goes wrong, we're always going to look after people. If a patient comes in with a crown and it's broken early, I'm going to see that as my fault and I'm always going to replace that crown for free. Whereas if it comes back with decay, which might be more of a hygiene problem, then we're going to have to look at it and have a bit of a chat with each other about what we're going to do here. But there might be some cost involved there because, it does require some work from the patient as well. I think the other thing is we're not trying to treat every single patient in Perth. You have to make that decision early with a business. What sort of business do you want to be? We made the decision we didn't want to be a high volume, cheap clinic. We don't want to see every patient. We want to do really, really good dentistry and we want to work with people that we click with. So I think the key thing is you don't have to see every patient. You don't have to get along with every patient. But if your aim is just to do really, really good dentistry and work with people, then you're going to get a good outcome. Yeah.
So Tim, do you ever get nervous when a new patient comes into the clinic, you've never heard from them, never seen them before?
I'm usually pretty excited to see a new patient because I'm really excited to demonstrate what we can offer and how we do things differently. And I think like the experience that we offer is a bit different because we're all about communication, transparency and coming up with a plan with people rather than sort of telling them what to do. But it can be nerve-wracking because if a patient's been elsewhere and seen a dentist with completely different philosophies, and then we're going to be talking about things that perhaps they've never been told before. You wonder, is that person going to trust you because you've never met them before? And suddenly you're making recommendations. It's tricky when you don't have that trust. So I think it is really, really important. Number one, just to be transparent. Just to be transparent, honest, act with integrity, and I think the rest follows from that. Do you ever feel nervous when a new client comes in?
I used to get so nervous, especially I'd say the first 5 years of my career. There would always be nerves. Exactly like you said, you don't know what they're coming in with. You don't know the experiences they've had. How many patients do we get? And the first thing they say is, man, I hate the dentist. I've had terrible experiences. I had, dentists put their knee on my chest, pulling out a tooth. Like, we hear that so much. And that would always make me nervous because you don't know, what anxiety they're coming with. And when you're feeling anxious, then it's really hard to communicate and share ideas. Now that we've built this place and we've had control over the whole appointment from the start to finish, from the person that greets you to how you leave, now I feel really confident. Now I get excited that, we got someone we can really, change their mind, change their experiences. Best thing I can hear is, I've never been to a dentist like that. I've never had an appointment like that.
I think people are sick of being sold to, and they're sick of slick dentists with slick sales techniques and slick sales practices. And I get excited to see new patients because it's often the first time that they just haven't been sold to. It's just, look, this is the situation in the mouth and these are the options that you have. And it's really up to you, for you to choose, personally, what treatment's best for you. And I think when you give people that experience of just giving them options, discussing things honestly, not putting any pressure on people. I think people are genuinely happy with that sort of treatment. Yeah. So Maheer, have there been any patients who've left a mark on you?
Early in my career, I had, maybe about 2-3 years in, so I had started to build a bit of confidence now, so my procedures were working. I had this super anxious patient, and first 2 appointments, she couldn't walk through the door at the front reception. So we had to prescribe her a sedative to just come into the reception, to write her medical history, and then just come for a checkup. Like, we didn't even take x-rays, nothing went in her mouth, just a look. But by the end of the treatment, she was coming in, she was getting needles without any sedation, she didn't need sedation. That's like the best feeling for me. That's what dentistry should be about now. It shouldn't be difficult. We have the best tools, we have the best techniques, we have rubber dam. Like, it should be easy. Patients should be just falling asleep in the chair.
When we're doing long cases, full mouth rehabilitations, you see the patients a lot and you do actually end up forming quite a close relationship with them. Especially the patients who've got quite broken down teeth. I find they've always got interesting stories to tell. The teeth's usually a reflection of their life, and a lot of them have had a hard life. They've faced a lot of challenges. They've overcome those challenges. Specifically, we see a lot of former drug users needing a lot of dental work because of the impact that drugs has on the teeth. And what's really life-changing is when these patients have battled through these enormous challenges with addiction. As a consequence, their health has suffered. Now they've overcome the addiction, and just to be able to deliver a nice cosmetic result that can allow them to go to job interviews and not be treated with prejudice, it's just insanely rewarding.
I love seeing them relearn how to smile again, and you watch the picture like 6 months later. Like, we always see these amazing before and afters, but the magic comes 6 months later when their muscles relearn how to show their teeth again. Before, you're trying to take smile photos of them and they don't know how to smile and they don't know how to bring their lips up. And in 6 months, they're like, their whole face has changed and their years are coming off their face. It's amazing. Yeah.
Before we've got a patient coming here for the first time, is there anything you'd recommend for them to avoid doing just to make their experience better?
I know a lot of patients come in and they might be a bit confrontational because they've had bad experiences, but I say just tell us the experiences that you've had. I think realize how different dentistry is. It's a really hard thing to wrap your head around if you haven't had these experiences in a modern practice. Yeah, just come in with a fresh mind and open to seeing all the data and seeing what we can come up with. The good thing is you'll never be told what to do. So if you come in, we'll take scans, take photos, we look at it all together. Usually you'll find yourself feeling really comfortable, feeling safe that you're getting the real information. So Tim, anything you would kind of recommend patients to avoid doing before they come in for a checkup?
I think too much Googling. There's so much information on the internet and so much of it is just garbage. I will tell patients, once we've discussed things and given treatment options, I usually say, now's the time for you to go and do your own research, like with the information we've provided. I think it is much better if you do your Googling after you've seen us, and we provided some guidance on the direction you want to go in. If you come in with sort of a preconceived idea of what you want, and that's what you want, it might not necessarily be the best thing for you. And based on our experience, we're going to offer, what I think is really honest and ethical advice. Like, we're always going to tell you the right things, the right options that you've got available. I think coming in with a preconceived idea of what you want done can sort of box you in a little bit. It's much better if you come in completely open and just get the options available to you and then do your research. So Maheer, what kind of experience can patients expect when they walk through the doors at Azure?
Firstly, you're going to be greeted really well. Like, our reception staff are so friendly, and they'll make you feel really comfortable. And then we'll be getting some of your information, your medical history, all that kind of stuff. And then our checkups are mainly about us getting to know each other and just gathering data. And then we'll look at the data together. We'll look at the photos together, we'll look at the x-rays together. Yeah. And we invest in softwares and things to make, for example, the x-rays really easy to understand for the dentist and for the patient. Just come in expecting that we're going to get lots of information, we're going to look at it all together, and then we're just going to have a really big chat.
I think the key thing is that we've just got an epic team. What I've realised is that working in a lot of dental clinics over time, some of them quite toxic environments, just sort of hostile, unfriendly environments, high staff turnover. For us now as owners, I would see staff turnover as a massive red flag that we're doing something wrong. We've put everything we can into making sure that we're paying people well, we're supporting our staff, and staff are happy. Okay, because if staff are happy, you're going to get a great experience. So I think we've done really well to create a really positive environment. And I think when people come through the door, they can really detect that people want to be here and the staff want the best for patients.
My name is Maheer, this is Tim. Just shoot us a message or leave a comment below. We're more than happy to answer your questions.